This is the American Journal of Psychiatry Residents Journal podcast series.
Hi, this is Jennifer Harris, and I am a second-year psychiatry resident at the University of Texas Southwestern Medical Center in Dallas, Texas. I'm here to discuss my article on the prevention of PTSD, predicting response to trauma, which was featured in the July 2015 issue of the American Journal of Psychiatry Residents Journal. Now, I first got interested in this subject when I had some difficult events happen to people close to me. And I started to wonder, why do people respond so differently to trauma? Is it possible to predict whether someone will incorporate the event in their lives and grow, or whether they will take a downward spiral? So you may have heard the term resilience, which is quite a hot topic right now. It is popularly used to mean lack of psychopathology, but that is neither a useful nor accurate definition. Rather, resilience should be conceived as a trajectory in response to a traumatic event that is characterized by a brief period of disequilibrium after trauma, followed by continued health. So resilience involves a trajectory, following a person's mental health over time. It does not mean that there is no dysfunction at all. That, indeed, would be defined as resistance. Some level of distress is universal immediately after trauma. After the Oklahoma City bombing, 96% of individuals reported at least one post-traumatic symptom. PTSD develops in 1/3 of those exposed to trauma. But what is remarkable is that not everyone exposed to trauma develops PTSD. 35 to 65% display a resilient response, which suggests that most people possess the ability to adapt to stress. So, what factors determine an individual's ability to adapt to stress? I explore several factors in my article, including the neurobiology, early life conditioning, epidemiology, and personality traits. As is true of many mental illnesses, there is no simple factor that can explain what trajectory a person takes in response to trauma. A physiological stress response is adaptive during traumatic events. Resilient individuals, however, are able to shut the stress response off after the event has passed, while individuals with PTSD are not able to shut the stress response off. Genetic polymorphisms have been identified in the sympathetic nervous system, HPA axis, neuropeptide Y, and serotonin symptoms that predispose an individual towards pathological response to trauma. In addition, early life conditioning shapes the development and responsiveness of these systems, likely through epigenetic changes. In addition, personality and beliefs influence response to stress. Is a stressor considered a threat, or is it a challenge to be mastered? Those who believe in their own agency, who have higher perceived control and respond actively rather than passively to threats, are less likely to develop PTSD. In addition, a strong social and emotional support system is associated with resilient responses to trauma. So what can be done? Are there any effective interventions that can be deployed prior to the development of symptoms to prevent PTSD? Several classes of drugs have been promising, such as antidepressants and antiadrenergic agents. However, there is no evidence to support the efficacy of most of the proposed interventions. Only hydrocortisone has demonstrated significant efficacy in preventing the development of PTSD, possibly by reducing the effect of HPA axis activation. Psychological interventions have been likewise disappointing. Initial efforts focused on single-session early psychological debriefing after the trauma. However, in some studies, the intervention group reported more PTSD symptoms compared with the comparison group. Recent efforts have focused on multiple-session CBT, but studies have shown no significant difference between the intervention and control groups. Better results have been found in programs that screen for individuals at high risk for developing PTSD or who already manifest acute stress disorder. In conclusion, can resilience be learned or fostered? One difficulty with interventions to prevent PTSD is that the known predictors of PTSD together account for, at best, only 27% of the variance in response to traumatic events. Response to trauma is a result of subtle genetic polymorphisms and the accumulation of external events that produce vulnerable phenotypes. However, as we continue to gain a better understanding of the human stress response, there is hope that we can learn to prevent PTSD and promote positive adaptation in response to stress. Thank you for listening. This is Jennifer Harris with Prevention of PTSD, Predicting Response to Trauma. For a more thorough discussion of this topic, please check out my article in the July 2015 issue of the Residents Journal.